Welcome to the webinar, Improving the Quality Measures, % of long-stay residents who received an antipsychotic medication. This webinar is part of a series intended to help nursing homes understand and improve the 13 long-stay measures that are used to calculate the Quality Measure Composite Score. This measure reports the percentage of long-stay residents who are receiving antipsychotic drugs in the target period. The target period is the span of time that defines the QM reporting period, for example, a calendar quarter. The numerator is the number of long-stay residents with a selected target assessment where the following condition is true: antipsychotic medications were received at least once in the last 7 days or since admission or reentry if less than 7 days. The denominator is the number of long-stay residents with a selected target assessment, except those with exclusions. There are 2 exclusions for this quality measure. The first exclusion is that antipsychotic medication use was not assessed, a dash for N0410. The second exclusion is that any of the following related conditions are present on the target assessment: schizophrenia, Tourette's syndrome, and/or Huntington's disease. To help identify what your team can do to improve this quality measure, refer to the RAI Manual Appendix C to find the care area assessments for psychotropic medication use. The care area assessment process provides a framework for guiding the review of triggered areas and clarification of a resident's functional status and related causes of impairments. It also provides a basis for additional assessment of potential issues, including related risk factors. The assessment of the causes and contributing factors gives the interdisciplinary team additional information to help them develop a comprehensive plan of care. For each resident who triggers for this quality measure, evaluate if the medications are necessary, if there are treatable or reversible reasons for the use of the medications, and/or if there are adverse consequences of the antipsychotic use that is exhibited by the resident. For each resident who triggers, evaluate if there is any drug-related discomfort that requires treatment, if there have been any status changes that may be related to psychotropic medication use, and input from the resident and/or family or representative related to the use of these medications. Then, analyze your findings, and for each resident, document a description of their antipsychotic drug use, the causes and contributing factors for the use of this medication, as well as the factors that put the resident at risk for adverse side effects. This information should then be used in the development and implementation of an individualized plan of care for each resident. Implementing quality improvement in your nursing home works best if your home has a culture that supports continuous quality improvement. Please refer to the CMS National Nursing Home Quality Care Collaborative Change Package that offers strategies that your team can implement to develop and enhance your quality culture. One of the strategies of high-performing nursing homes found in the Change Package is to provide exceptional, compassionate, clinical care that treats the whole person. Decreasing the use of inappropriate antipsychotic medications is a great example of this strategy. Change Package Attachment Number 2 also includes a bundle of interventions to help promote avoidance of these medications in residents with dementia. Please refer to the link on this slide to find other proven strategies to improve the quality culture within your nursing home. Refer to the MDS 3.0 RAI Manual and the MDS 3.0 Quality Measure Users Manual for more information about the quality measures. To clarify questions about the MDS and/or the quality measures, contact your state RAI coordinator. For further information about the quality measures or about the Nursing Home Quality Care Collaborative, please contact your state Lake Superior Quality Innovation Network lead listed on this slide. Be sure to check out our short videos on each of the 13 quality measures that make up the composite score. Viewing the videos for each of the measures will help your team understand how each measure is calculated and will offer suggestions on first steps to improve each quality measure. Thank you.